Universal health coverage, or what we like to call UHC, is a state in which all people who need health services are able to get them without necessarily suffering from financial consequences of paying for health care. It's a really interesting question how COVID-19 may actually affect whether or not people are able to get the services they need and how much it's going to cost them. And I don't think we have a full answer to that question yet. However, I think countries that do a better job in terms of providing UHC to its citizens are likely to do a little bit better than those that don't. But that's not the whole story. We may want to dig a little deeper. For example, even countries that do have universal health coverage, some of them rely on, for example, tax financing to support their health systems. And others rely upon other forms of financing, such as social health insurance or private health insurance, to achieve the same result. Tax financing is probably something that is likely to be more stable, and governments are likely to have more control over it. So when the outbreak happens and the response happens, governments are probably going to be able to fill in the gaps a bit more if they rely upon tax financing. One of the things that we've seen happen in many countries around the world over the last couple of weeks is a number of people losing their jobs as a result of some of the public health and social distancing measures that have been put into place. And if you get your health insurance through your job, some of those places are likely to suffer more. And so I think there's a need to think about tax financing to fill in the gaps to ensure universal health coverage is met, even in places that had it before. Some places, of course, don't do a great job at ensuring that their citizens have UHC, and those countries will clearly do worse than others. In particular, places where people are required to pay a lot for health services. We might, for example, see people reluctant to come in to get tested. And so it's really important that we ensure that people don't have to pay out of pocket to get a test, for example, so that people aren't discouraged from coming in. And then once people do come in, that they're guaranteed to get their services covered so that they're not faced with this huge bill for paying for the care that they received.